The meeting today has been discussing alternatives to antibiotics for patients who come to their own doctor with symptoms of a respiratory infection like a sore throat, a cough, an earache, or sinusitis. These are all conditions for which antibiotics are very commonly prescribed, but we know that in most cases the antibiotic is not necessary. And the question is, patients often expect to be given something. They're not satisfied if you just say to them, go home, you will get better in 1 week, in 2 weeks, in 3 weeks. People want something to help them get better faster. And the question we've been asking today is, could complementary therapies help them to get better faster? And the conclusion we've reached from looking at the literature is that there is some promising evidence for some complementary therapies that it could help people to get better quicker. For example, pelargonium, which is a South African herb, can help people to improve quicker than no treatment for bronchitis or sinusitis. Andrographis, which is an Indian herb, can also help patients improve more quickly from cough and sore throat. And so we could already tell patients this information because in some countries these remedies are available over the counter. And in fact, it would be even better if people could use them without coming to see a doctor, just to self-manage, as long as they know when to come and see a doctor if they're really getting worse. But there are many questions that remain to be answered. The studies that have been done don't look at all the countries of Europe, and we know that there are big differences between different European countries. So some countries like the Netherlands have very low rates of antibiotic prescription. And by the way, anthroposophic medicine and complementary medicines seem to be very popular in the Netherlands. There were many representatives here today from those disciplines from the Netherlands. But in other European countries like France, Italy, Greece, use of antibiotics is very high. And we don't have much information about what patients there would think if we were to offer them herbal medicines instead of antibiotics. So we need to explore this further. There's more work that needs to be done. And it's urgent to do it because the antimicrobial resistance is accelerating. We're told that by 2050 there will be 10 million people dying every year from antibiotic-resistant infections. So it's not something that we can afford to waste time on. I mean, so it was very interesting at the beginning of the conference to hear about Tuscany, a particular region of Italy which is hosting this meeting, in fact, and how they have been promoting and making complementary medicine available as part of the health system. So if in Tuscany complementary medicine is integrated in the normal health system, has that had any impact on use of antibiotics? Is Tuscany better than the other regions of Italy for use of antibiotics? That would be really interesting to study. I don't know if anyone has studied it. I don't think they have. So that would be really interesting. Also, we heard about different initiatives in different parts of Europe. So I think looking at use of complementary medicine versus use of antibiotics in different areas would be a really interesting thing to do.